Since ancient times, people have been trying to find a way to control illness. Early on, people realized that finding the cause of disease was important. Unfortunately, they had very limited knowledge of germ theory, and as a result, they blamed illness on bad morals and spirits. Some of the first attempts to stop the spread of disease included placing infected crews and ships into a quarantine before allowing them to enter major cities. An early example of this were the quarantine laws of Venice in 1398. Unfortunately, early attempts to control outbreaks were reactionary, and so little was being done to prevent future epidemics. For those suffering through an outbreak, there was no one to turn to, and no relief in sight. They just had to ride out the outbreak and hope that they wouldn't be unlucky enough to be infected. However, this began to change with the creation of organizations dedicated to fighting back against these diseases. The first example of a coordinated effort by a public health organization came as a response to an outbreak of yellow fever in Philadelphia in 1793. Yellow fever was an extremely dangerous virus spread by mosquitoes. This virus caused a variety of terrible ailments, including chills, fatigue, fever, yellowing of eyes and skin, and finally, fatal heart, liver, and kidney conditions. 100 people were dying a day, making people decide that they needed to do something to help stop it. Philadelphia city government's response was not well organized, and there were no higher organizations that they could turn to for help. Thus, they began forming health departments to stop another epidemic, one of the first examples of this type of organization. Soon, local health departments started popping up in Washington, D.C., Baltimore, Boston, and in the next few years, most major cities had one. Public health infrastructure is now seen as the backbone of a healthy society. There is now a multidimensional approach with organizations at the federal, state, and local levels. These organizations have considerable power to control private behavior, impose regulations, and are held to a high standard. Having networks of communication helps in coordinating efforts and spreading insight about the successes or failures of certain approaches. The federal government can pass down newly researched approaches or communicate what might have worked in a different region, whereas local organizations can take information from above and tailor it to the specific needs of its own community. The impact of modern public health infrastructure is apparent when considering the containment of historically widespread and deadly diseases. An example of this is the containment of yellow fever. What was once a common and deadly disease in the United States has been almost completely eradicated domestically. However, we still see cases in other countries, especially those with developing healthcare infrastructure. We have reached a point where organizations are now able to reach beyond borders to help those in need, creating public health infrastructure at the global scale. Of particular interest to us is the Eliminate Yellow Fever Epidemics, or EYE program. This has shown promise in completely eradicating this disease worldwide. It provides structural support to 40 at-risk countries in the Americas and Africa to prevent, detect, and respond to yellow fever outbreaks. As a result, by 2026, it is expected that more than 1 billion people will be protected against this disease. Public health infrastructure has come a long way, from the quarantine of individuals that showed signs of illness, dooming them to their fate, to having organizations in place at the global scale to slow the incidence of illnesses before they've even begun.